Dr. Therian here, and if you're watching this video, we likely talked about a PCO or posterior capsular opacification during your eye exam. Now, this video is just here to supplement what we've already talked about. It doesn't replace the need for eye exams. And so basically what happened is after cataract surgery, we either got a folded little tissue that was left behind the new lens that they put in there, or we left some cells behind and they're growing on the backside lens. So it's not that the surgeon did a poor job or that the surgery failed. It's just that we have a little bit of scar tissue. Now, when I first got out of school, about 50 to 60% of patients that had cataract surgery ended up with a little PCO. Nowadays, it's about 25-30% because we have a little bit better microscopes to look at things. And so it still happens, very, very, very common. And whenever it happens, it'll start to give you kind of similar side effects or signs of like what you had after cataracts. And so you'll notice glare at night, just overall general haze, fuzziness. And so it'll kind of replay almost like a cataract. That's why some people refer to it as a secondary cataract. I talk about it more as scar tissue. Neither one's really accurate. It's not a second cataract. It's not actually scar tissue, but I just prefer the nomenclature of scar tissue for whatever reason. And so again, symptoms are going to be similar to that of what a cataract is, but it's a very simple, very easy fix. And so typically we'll do a YAG procedure. It's very simple, very easy laser procedure. Yes, laser procedures do have risk to them, but the likelihood of a problem after a YAG procedure is dang near non-existent. I mean, in doing this for over a decade, I haven't had any patients that have personally had any problems after a YAG procedure. So I'm not going to say it can't happen. I'm just going to say that it's a very low probability. And so typically individuals have that YAG procedure and it's a one and done, but occasionally, you know, when they create the little cleanup, it'll get a little bit left behind and they may have to go in and do it a second time. But again, that's pretty rare. In 10 years of doing this type of stuff, I mean, I've maybe seen 1 or 2 patients that have had to have that retreatment on it after a YAG procedure. So again, PCO is nothing to get jazzed up about or nervous about. Pretty simple, pretty easy fix. If it's bothering you a lot, we can get a YAG procedure taken care of and get you fixed up. And so, as always, this video doesn't replace the need for eye exam. It just supplements what we've already talked about. So if you have any questions, you know how to find us.